Martin, who's a London-based GP with specialist expertise in women's health, menopause and weight management. She's a passionate advocate for health equality, and she's the founder of HEAL, which is an acronym for Black People, and leads Black Health Equity Day, my apologies, working to tackle disparities in care affecting African and Caribbean communities. She's got over a decade of experience, and she delivers holistic, culturally competent care which empower patients to take control of their health through evidence-based guidance and inclusive education. I'd like to welcome Dr. Johnson, who's arrived slightly late, but really looking forward to hearing what you've got to say about women's health, which I desperately need a lot more of support with. Thank you so much. Let's give her a round of applause.
Thank you for the introduction. I'm sorry for being late. It's, you know, what we have to do, the juggle. I was waiting for my husband to come and take over childcare so that I can come and talk to you. So this is the reality of women's health, isn't it? The mental load we carry. So thank you so much for having me. It's an honor to be here and to be amongst community and just here to be able to share about women's health. So women's health is incredibly broad. So I've decided to focus on hormonal health in Black women, and that covers all the life stages from puberty to pregnancy, post-pregnancy, and then obviously perimenopause and the menopause. So some of you who might know or have heard of the work that I do might know that I have written a booklet which is a personal guide to menopause for Black women, and it specifically explores the nitty-gritty of the impact of menopause as it affects Black women. So if you do want a copy of that book, it's available for free from my website. You can come and pick up one of these from me, and then it shows you how you can get the free e-copy. If you want to buy a physical copy, you can also get it on Amazon. I've tried to make it as cheap as possible. I think it's £3 something. So it's as cheap as possible. So if you wanted a physical copy, you can get it on Amazon. But you can get a free e-copy from my website. Right, perfect. Thank you so much. So about me, I think I've been very kindly introduced, which is lovely. I think one of the things though that I want to highlight is about my own lived experience as a woman with health issues. So I was 27 years old when I was diagnosed with hypertension, and that happened because I'm Black. And because it is Black people who get young onset hypertension. But it also happened because I've got PCOS. And because of PCOS, which is a whole body, not just a reproductive issue, I have hypertension, I've had pre-diabetes, which thankfully I've reversed because I've been working on my weight management. I had struggled with fertility, and eventually ended up having to have fertility treatment to have my son. So when I talk about women's health, it's not because I'm a stranger. I'm actually also a patient as well as a clinician. Right, thank you. So why is this important? Why is hormonal health important? Because it impacts all life stages. And Black women, unfortunately, have higher risk for a lot of things, and worse symptoms, and painfully are still underdiagnosed. And then there's a lot of misinformation and stigma in our community, which results in delayed care and silent suffering. You know, I think we've come to, and for good reason, because so many awful things have happened with the traditional medical community and the Black community. So we're almost at an impasse where there's just not that much trust. And so people turn to things which might not be that effective or have a strong evidence base because they want to feel safe. and they don't feel like Western medicine or traditional medical services provide that place of safety. And this is really why we want to change that narrative. I'm a Western trained doctor, but I make sure that everything I do is evidence-based, but also holistic, also culturally competent and inclusive. Hormone issues affect mood, energy, and daily life. So when we learn about these things, we can make more informed choices, which can improve our health. So let's just have a quick glance at what the hormonal system looks like in a woman. So we've got the hypothalamus, which is in our brain, which is the governor of the endocrine system, so to speak. It's like the president. And then we've got the prime minister, the one that actually does all the work, which is the pituitary gland, and it secretes the hormones that control all the other glands. And then we've got the adrenal glands. So the adrenal glands produce hormones like adrenaline, cortisol, and other really important hormones that help us manage stress and metabolism. And then of course, we've got the thyroid glands in our neck. We've got the pancreas, which produces insulin. We've got the parathyroid glands, which help with calcium and vitamin D regulation. And then we've got our ovaries, women, which is really important because they help control menstruation cycle, but the estrogen that we produce from our ovaries also is a whole body hormone. We often think about it just in the reproductive category, but actually in the brain it impacts mood, it impacts libido, which is our interest in sex, it impacts temperature regulation, and it also impacts memory, which explains some of the symptoms we get in menopause. So at puberty, I've seen a few young people around. The hormones kick in and they tell the body it's time to start developing adult sexual characteristics. And then the body starts changing. So in young girls, breasts will develop, hips will widen, height will increase. And then of course the first period begins, which in medicine we call menarche. And then the menstrual cycles start. They can be irregular at first. Now, for those of us who are parents of young people or grandparents, you will also recognize this. The emotions and the moods start to shift as well. And this is a direct relationship to the hormonal changes that are occurring. So the menstrual cycle, it starts, so if we say day one is the start of menstruation, and that's the shedding of the womb lining, and then we get to the follicular phase, which is the phase led by estrogen, which is when the egg grows, and then the lining starts to be rebuilt, and then we get the egg release. And that happens in the middle of the cycle. We call that ovulation. And then we get the luteal phase, which is progesterone, and that's when we're like, I'm a bit moody, my breasts are a bit sore, not feeling 100% best. And then period begins, and then we go back again. Woo! And so it's a cycle. Yeah. And as I said, different aspects of the phases. So the rising estrogen gives us energy, focus, a better mood. We feel more confident with estrogen. With progesterone, we feel more mood swings, a bit more anxious. So, but other things, other factors, or what else is going on in our lives can impact this. And that includes our health or health issues, stress, what's going on in our lifestyle, how well are we looking after ourselves, what are we eating, how are we moving, are we prioritizing joy, all of these things which are super important for our well-being. Okay, so what are the hormonal issues that can happen in puberty? So irregular periods, often that can be quite common as young girls are settling into their periods. They can get cramps and pain in their periods, and if that's impacting their lives, that should be taken to a doctor because there can be help, or nurse, or a healthcare professional, because there can be help for that. Acne, we know that this is often a common problem for young people. Again, there's help for that. And then of course, premenstrual syndrome, which is this PMS that we often talk about. And that can be quite difficult to manage. Of course, lifestyle can really help with this. So what we're eating, how we're moving, how we're managing our mental load. But for some young women, it really is quite disturbing, and they can even move into something called PMDD, which is premenstrual dysphoric disorder, where young girls can even have suicidal thoughts, and we've even had young women kill themselves in this phase because it's so awful. If you are worried that your child or your niece or whoever is struggling, please take it to a clinician, because there's help. There's things that can be done, and there's treatments for that. And so, these are the things that generally tend to happen with PMS: the irritability, the bloating, the breast pain, the cravings. And as I say, you can have quite severe symptoms, so really important to get that checked out if a young person is not able to cope. So during the reproductive years, you've got your monthly rhythm, your cycle resets. But from about the mid-30s, around 35, particularly for Black women, the hormone pattern starts to change. And we start to become less fertile as we start to work our way into perimenopause. Okay. So, we just talked about this. So, during the reproductive years, though, there's some really important medical conditions that we need to be aware of, including fibroids, which are more common and severe in Black women, hormonal disorders like PCOS, which I mentioned, which can affect the whole body, increase our risk of diabetes, heart disease. So it's not just about the irregular periods and the fertility concerns, which are obviously important. PCOS can also increase your risk of endometrial cancer. There's also endometriosis, which is a condition where the womb lining grows outside of the womb, and we can see that in the pelvis, so on the ovaries, all over the pelvis, but also sometimes people have it on the gut. So it's even been found in the lungs, in the brain. And again, we get delayed diagnosis in Black women, and it can really impact our health. And then there's infections, which can happen. So it's really important that we get regular sexual health screens, and that includes things like chlamydia, gonorrhea, HIV, syphilis, all these really important things. And also very important in our community that we're doing our cervical screening and attending that. Okay, so perimenopause is the hormonal shift that begins as we move from our regular cycles into the menopause. And that's when estrogen starts to do this crazy dance as it sort of rises and falls, and it's all over the place as we head towards menopause, which is a year without periods. So menopause is that one day in your life when it's been 12 months and you haven't had your period. Before that is perimenopause, and then after that is postmenopause. So every journey is unique, and timings and intensity vary for each woman, but it's important to know what the common symptoms are. So hot flushes, sleep issues, mood disruption, but also remember the vaginal symptoms, so things like vaginal dryness, things like urinary incontinence, urinary frequency, increased UTIs, but then there's also other kind of non-specific symptoms like fatigue, joint aches and pains, brain fog, feeling like you can't concentrate, you're not quite yourself. And we know that Black women are more likely to get these symptoms earlier, and they're more likely to last longer. And also, really importantly, early menopause is more common in Black women. And this is a serious health issue because early menopause has an impact on our heart health and our bone health. Because if you have menopause under the age of 45, you're at increased risk of heart attacks, in the later life. And this is really important for our Black community because we also have increased risks of hypertension, which is something that we often, by 40, 50% of us will have hypertension. And many of us will also have 3 times more likely to have diabetes. So our risks are already high. So with early menopause, it's really important that we seek medical attention. And in this particular situation, hormone replacement therapy would be the recommended treatment unless there is a contraindication. Okay, so we've talked about internal hormones. There's also external hormones, treatments like HRT and contraceptives, which are really important for certain conditions and management of certain conditions. So sorry. No, it's fine. So, as I said, contraceptives can help with preventing pregnancy, regulating cycles, and in menopause, HRT can help with relieving the symptoms, but also with helping protect our future health from heart health and bone health. Now, of course, there's always people raise the risk about breast cancer with HRT, but that risk is really small and much smaller than the risk of heart disease. So 50% of women die from heart attacks, only 3% die from breast cancer. But we're always so much more worried about breast cancer when in fact heart disease is a much more important thing for our community. So, you know, I haven't got much time, but this is just around the internal versus the external hormones. I really wanted to find time to address this issue. We have a lot of distrust for real reasons, as I've explained, around hormones in our community. And there's a lot of myths which are just not true as well. So it's really important that you find accurate information, speak to doctors who have a culturally competent approach before just knocking off hormones as not an option for you, because it may well be the best option for you. You need to have an open mind to have a conversation. But then again, it's not for everyone. So it's not like I'm saying it's the right choice for everyone. But in certain contexts, it might even be life-saving. And also, you know, we've got a lot of stigma in our community around this. So that's something else that we need to address. Okay, I'm well aware that I'm running out of time. But one of the issues in our community is this lack of cultural competency and the lack of evidence. So I'm just going to end by saying, you know, seek professional help. Expert providers are here, doctors like myself, and there's quite a few of us who really care about our community and want to make sure that we're here for our community. Don't hesitate to get a second opinion if you need it, and always consult a professional. Don't just lean on TikTok or WhatsApp posts. They often talk rubbish. But that's not to say that there are clinicians on there that do give good advice. So I'm just going to open up to, finally, don't forget self-care. This is so important. Green spaces, eating well, hydration, staying active. All of these things are really important. Right, so any questions in the room? Yes, please.
I can see several fans going on here. So I'm not the only one who suffers with constant hot flushes, or flashes as the American calls them. What is it? I mean, are there better natural ways of replacing estrogen other than through HRT? What are the other options available that are better for Black women?
Well, I wouldn't say that any of it. I would say that with the evidence that we've got, HRT is the best option, even for Black women, for all women. That's the evidence. But I appreciate that not all Black women want HRT, but I think we need to explore the questions as to why not, because people often think that HRT is synthetic. It is not. It's actually body identical and naturally derived. Most of the HRT that we use in this country is actually naturally derived from plants. So all the estradiol that I use in my practice is body identical, so same as our body produces, and naturally derived from plants, and then the progesterone. So we have some synthetic progesterones that we use, but we do have a body identical progesterone called micronized progesterone, which is also naturally derived from plants. So, and we know what we're giving you when we give you HRT, as opposed to saying, okay, go and get some wild yam and do your root extract, or saying go and buy some black clover. We don't know how much is in that. So is it possible to use supplements and things? Of course, but you have to be careful because it's not as regulated as hormone replacement therapy, which is body identical and naturally derived. So when I say that it is the best treatment, it's for all those reasons. And so this is why we have to have a conversation based on facts, rather than, an assumption, because historically it was made from horse urine. That's true, but we no longer use that.
That's reassuring.
Yeah.
Very reassuring. Any other questions, please? From postmenopausal ladies in the room?
Yes.
Yeah, I did. Somebody had said a couple of years ago, because we did for WACA, we did a webinar, and one of the things that was in the chat is somebody was saying they had been post-menopause for something like 25 years, and I'm like, does this thing never end? So I just like your steer and just your thoughts on that.
Okay, so most women will have symptoms for around, it's very personal, but for black women, the average is around 10 years, and usually the symptoms stop. Most of the menopausal symptoms get better, so the hot flushes, the mood swings, the brain fog, most of that gets better. But there are some symptoms which will worsen with time, and those are the genitourinary syndrome of the menopause that I spoke about. So that's the vaginal dryness, the urinary symptoms, the incontinence. If that's not treated, that will not get better. That will worsen with time. But there are some women who have symptoms for longer, and some forever. So it's a very personalized issue, but the vast majority, the symptoms will get better, the systemic symptoms will get better in time.
Wonderful, thank you.
Any other questions, or we're done? Right, thank you so much for having me, really appreciate it.
Thank you. Thank you very much. Excellent, thank you so much.